Okay. All right. Well, we've been visiting different organ systems that do affect the heart, and the heart affects them, and also our lifestyle affects them. And so we went through blood, and obviously cardiologists live in blood, and so we have to understand blood and clotting factors. Well, we're going to go to something totally. And I'm not the true expert here. If you have a true liver problem, please don't ask me all the questions at the end, about it. But liver health and heart health do go together. So just basic anatomy. I mean, we've got this big organ, the liver, that is very vascular. That's right below our diaphragm in the upper part of the right abdomen, and stomach ends up being right below that, but the pancreas is tucked in and around there. Right underneath the liver is the gallbladder, and actually the gallbladder will empty bile into the bile ducts that course actually through the pancreas and becomes a common bile duct, and on the way out to the gut. And what is this bile being used for, as we'll talk about, is kind of a detergent for fat and fat absorption. So the pancreas releasing all these enzymes that help to dissolve or break up proteins, break up the carbohydrates, as well as just over time other bacteria and things getting involved in the gut. But the liver does so much. So what does it do? Well, I'm going to list all the 500 processes here. So by the end of the hour, I'll get through it. No, it does a lot, and it clearly helps us digest our foods. It rids the body of waste products. It produces clotting factors that keep us from bleeding to death. It's a factory. It's a filter, and it's a foreman actually telling the body, what it needs to have. So there's so much more, that it does. Produces albumin that prevents us from the water within our blood vessels is leaking out into the rest of our body. It produces bile, as we were talking about, this detergent. It makes proteins, it makes amino acids, and makes the building blocks for a lot of things, whether our hormones, whether vitamins. It even produces the immunoglobulins that are our infection-fighting agents that are in our bloodstream. It processes and stores and releases sugar. I mean, it's clearly an area that sugars and fats will tend to be stored and released when needed, and it becomes a big part of that. I mean, people know Greek mythology. Do you know Prometheus, the story of Prometheus? Well, this is, just picture this man's chained down, and we'll tell the story. This eagle is above him. Prometheus was kind of a semi-god. He was a man, but he was kind of somehow knew the gods, and somehow was able to steal fire away from Zeus and give it to humans. And Zeus got mad because he was in control, and that gave man this control of some things. So there was other things. I think Prometheus actually was messing around with his daughter. So I think at that point he just decided, I'm going to chain this man and punish him. So they chained him to this hill, and this eagle would fly in every day and eat his liver. And then by the next day, it would grow back, and the eagle would show up again and eat his liver again. So back in Greek mythology, they clearly knew that the liver had this amazing capacity for regenerating itself. And in fact, it can regenerate even as loss of up to 90% of the liver. It can come back, and that's something. But the problem is, some of us out there have pushed it. It's not invincible, and it can fail, and some have pushed it to failure, and we'll talk about that. And some of the symptoms of that failure of the liver ends up being jaundice, this yellowing of the skin, the really darkening of the urine, and the stooling becoming pale, creating this bleeding, bruising, confusion, nausea, abdominal swelling. I mean, it's there. The liver failure is not pretty, and in the United States, yearly about 7,000 people undergo liver transplantations every year. And what are the reasons for this failure? Well, the number one cause of it right now is people are eating too much. It is this metabolic associated steatohepatitis, or MASH. It looks like mashed potato, but MASH is the number one cause. Years past, it would be alcohol or some type of hepatitis from some viral hepatitis, especially B or C. But people are weight gain, liver failure is happening mostly from what people are eating or eating too much. And two slides, yeah. This MASH, is fatty liver. You hear that word, but it's more than fatty liver. It's the steatohepatitis. Steato is the fatty part. The hepatitis is the inflammation, and over time, this just heads toward liver failure. What happens is the normal liver cells, get infiltrated with fat that just separates the cells from each other. So you end up getting this, what the upper one being the normal cells and a nice liver type color, being this yellowing or fat, infiltration, and then unfortunately what begins happening beyond that is this hepatitis or inflammation. So you can go from, this is using the non-alcoholic fatty liver disease. That was the old name. More recent, just in the last few months, is MASH. So but you'll go from this fatty liver to inflamed fatty liver to scarring and cirrhosis. And there is ways with weight loss and some degree of medication that we're going to talk about, that people can reverse it at almost up to that gone way too far, that the liver has absolutely begun to fail. But some degree of cirrhosis can happen, and people can actually still reverse that. So what are the complications of liver failure? Well, if the job of the liver is to filter the blood, then and detoxify, get rid of certain chemicals, that are in the blood, to process it in different ways. Once it starts to fail, all of these things just quit happening, and so you start getting this buildup of toxins in the body, and actually we don't break down even nitrogen or our proteins well enough, or can reprocess them in different ways, and so ammonia starts building up, and once ammonia starts building up, people start getting sleepy and confused, and can't think straight, and even can't use their muscles correctly. People start getting lots of other problems. The arms, the legs start losing muscle. They don't make enough muscle, so you get the muscle wasting. You can get some of these toxins, they're vasodilators, may start getting reddening of the nose and even the palms of the hands, and you may get ascites or fluid into the abdomen that starts pushing out into the abdomen, and that it can even get infected and create what's called peritonitis. These spider angiomata, they're just new growth of little small vessels. These can happen on the skin. it doesn't show even further within, and we're going to show even the esophagus can get these varices or varicose veins around the esophagus that can bleed, and that's a real major problem with bleeding, people bleeding to death. So it's not pretty. It's not pretty at all. So the liver can get fatty. The liver then can develop cirrhosis. What's interesting is even in the number of transplants that are available out there are getting less and less because so many people in screening have fatty liver. So you know that the number of livers that are nice and clean are becoming less common, and it's related to weight. And even transplanted livers can get fatty if a person doesn't follow good dietary plan. So when you hear a doctor tells you, oh, by the way, you have fatty liver, that's not a little thing. That's a big thing. And that's what I want to say. For years, I think I've been hearing that. Oh, you know, patients come to me and say, oh yeah, my doctor told me years ago I have fatty liver. Well, what'd you do about it? What'd he tell you to do about it? Well, the key is you need some weight loss. I mean, there's a need to adjust your diet to really, you know, get better substitutes for food. Got to reduce the simple sugars for sure, and alcohol is a simple sugar, and so alcohol can be eliminated. The you know, higher intake of plant-based nutrition, and all of this is needed to get that degree of, you know, weight loss, and finally just this removal. The body can restore the normal appearing liver. There was a years ago I was involved in a weight loss clinic when I was moonlighting while I was a cardiology fellow at Emory in Atlanta, and I had this job on Thursday afternoons to late Thursdays to supervise weight loss. It was a weekly check of people who were on 800 calories of almost an Optifast type liquid, and it was a product called HMR. But it was they really did track and follow people well. But I watched this weight loss happen. Well, an HMR product was studied in the same type thing, 800 calories a month, 800 calories a day, for however long it took to reverse the fatty liver. And actually, they saw reversal in about 6 weeks, you know, on it. So really, people could really make a huge, you know, substitution of what they're eating and really make a change. So it was an interesting study. We know these associated other problems related to fatty liver, and this is what we call the metabolic syndrome. This is hypertension, hyperlipidemia, type 2 diabetes, all come together, you know, in this excess, not only visceral fat, but hepatic fatty fat, and even as we talked about down here, the intramuscular, you know, fat that can happen, and all this leading to insulin resistance, where the normal produced insulin cannot activate the cells to take up sugar adequately, and therefore blood sugars go up, insulin levels go up. The problem with insulin going up, as we talked about, was it increases storage of any excess of both sugar and fat. So as insulin levels get high, that storage is going up and up to try to lower the sugar levels in the blood glucose levels in the circulating blood. So it will just pack it away, and it packs it in the liver, in the adipose tissue, and in the legs and muscle. So if it packs it too much in the liver, that's where we're getting this problem of failure. So back to the liver. You know, muscle, as we've talked about also down here, muscle is health. And muscle loss is a problem, and it's a health problem. And so as the liver does make amino acids, but if the liver fails and we're not making adequate muscle, then this becomes a greater problem for the rest of the body. Clotting factors are made, and if someone, these vitamin K, and so anybody here on warfarin or Coumadin, we talked about that's a warfarin inhibits vitamin K factors of the liver to allow the blood to be thinned. And then of course you follow the blood level, the proton or the INR, and that's important. Well, people with liver problems can develop very high INR levels. I mean, it just takes a long time for them to clot because they don't have these vitamin K factors. And at the same time as the liver gets under higher pressure, it can back up that pressure and create these varicose veins in and around the esophagus. So you combine these esophageal varices with this blood thinning, and it starts to bleed. It is a horrible type of GI bleed. It is a big, and as we all kind of jokingly say in medicine, blood will stop at one time, but will it stop in time? For people bleeding out. And it's a horrible thing as nurses and stuff, they've been having to be around a bad GI bleed. It's not a fun thing to witness. Ammonia levels and encephalopathy. This is horrible because it can lead to confusion, to incoordination. It can lead to seizures. And it's this protein is not being processed well enough, and it just allows this excess of ammonia to build up. And you even smell it on people's breath. It's just it's an unusual thing to witness and see. As proteins in the body just are not filtered enough, it puts that excess even on the kidneys. And we'll talk about kidney function in another lecture, but this hepatorenal syndrome can set up where things are just not even being cleared well enough by the kidney. Then, kidney failure can come along. So 1 in 10 people with liver failure can develop kidney failure, and this hepatorenal syndrome. So it's and then also this problem with ascites and all of our fluids, almost way too much fluids not being within the bloodstream, but external to it in the abdomen. We can even have a cardiohepatic interaction, the heart and the liver interact. And we know that patients with lung disease can develop right heart failure. We call this cor pulmonale. And that can even back up pressures to the liver and overload the liver in a way. But even in this liver failure situations, the heart, because of muscle dysfunction, can actually reduce overall pumping function, and there becomes this cardiohepatic interaction. So just making mention of it. Of course, back to how do we prevent it? Well, lifestyle. I mean, it's just just normal, good nutrition with good physical activity can help in a huge way. Limiting the amount of alcohol. I mean, another lifestyle thing. Give your liver a break. Even if you do enjoy having alcohol through the week, give at least 2 days out of the week that you do not drink, and it just gives the liver a break. There's this well-balanced food. We want to get at least 5 to 9 servings of fruits and vegetables, that fiber, the nutrients, all those things where vitamins can be made, and we do give the building blocks adequately with that. We don't have to have absolute meat sources. So plant sources work real well. But I'm an omnivore. I'm a reducitarian. I always tell people I'm going to reduce the amount of meat, dairy, and cheese that I eat and make good substitutes for those. But if a meal comes along that's got chicken, fish, even beef, I'm not at least overloading my liver and with excess fats. Remember cheese. I've always used the term cheese down here. It's 80% fat. 80% fats. And as we've known, the nation is going nutty on cheese consumption. We've gone from 6 pounds a year to over 44 pounds a year. That's right. The amount of, it's not the cheese itself, but it's the amount. They're putting it in the crust. They're putting it a pound on the pizzas. Can I add another slice of cheese for you? Let me have 4 slices with this sandwich for cheese. We're overdoing it. It's just too much. And it's not the cheese, it is the amount of cheese. And it's 80% fat, and it's calories. And in fact, take just a hamburger and you put a slice of cheese on it, you double the calories of that hamburger. I mean, you might as well just put another slice of beef on there. I mean, meat, just another, 2 patties instead of, so that thinner slice thing is 1 more patty you're adding to things. So just different ways of thinking about it. Also, our liver clears our toxins. We're at the top of the food chain, and we are at the mercy of our environment, what we eat, what our exposures are, what's in our water, what's in our air. And our liver does a lot of extracting of this. Fish, we've talked about the mercury that can be in fish. I've mentioned down here a cardiologist in Gainesville developing mercury poisoning from eating too much tuna. And she was having tuna fish at least twice daily, with cans of tuna fish. So just overdid it. And but our liver can clear things pretty well. Crops, we get pesticides, we get, what's the process for chickens and cows, what's the chemicals used even in the plants, what's used in the preservatives of processed foods. Are they good for you, or what is that name? I mean, you read if you don't recognize it in the ingredients, it's probably good. Maybe I don't want, a 30-year shelf life or something, that's what, but some of these things are made to be 30-year shelf life, Do you
recommend the grass-fed beef and things like that, and then organic vegetables?
Yeah, I think it's good to recognize it. I wish there was more local farmers market ability for us to go. I think it would be great to one day in Tallahassee have a 7-day or at least 5-day farmers market that was available. I mean, if everybody's ever been to around Atlanta, the DeKalb farmers market, unbelievable. I mean, I was spoiled in Atlanta for 6 years. But the initial one that was a smaller one was in walking distance of where we lived, and so my wife and I would walk down there and then walk back with all these bags, and it was just wonderful. But then they developed the massive warehouse with it's huge. I mean, but it is. But you can talk to the people, know where things are coming from, understand a bit more the process of the foods.
And there's a shopping center that's the community co-op over on that's Appalachian. Yeah.
Okay.
They have some good. They have grass-fed beef
and I think it's good. I think
chicken.
It's good to understand the process,
Right.
so you're not what's in things. Nancy asked me to talk about something I definitely know a lot about. No, I don't. She said, you got to talk about detoxing and cleansing. And I said, okay, I'll take this on. And I don't know a lot about it. Clearly, I think we can, if we just give our body time, it will, and eat right, slept right, drank, just water and had to, I think we wouldn't have to, if you will, be so restrictive and go on any type of kind of cleanse. But these are some of them are unusual. Watch out for the supplements that get sold with these detoxes. They're not regulated by the FDA, and so it's buyer beware. And so people can get these. We're going to go over just what's in some of these, but I think it's reasonable to, in my faith, Lent comes along, and you end up really trying to withhold certain things. You try to, of course, what's Fat Tuesday all about is basically eating everything in the cupboard, so you cleanse it out, and then you go on, your 40 days, to Easter, and so, but I think the process of Lent is a bit of that, let's clean up the body. Let's, my faith to clean up the temple. This is important. To stay clean and to do it. And I think it can do that over time, so it doesn't have to be anything drastic. The liver cleanses, what tends to be in it, things like milk thistle, turmeric extract. But both of these, even though they're used a lot, there's really no studies. I tried to look for a study on in either of them. It's probably, like we said, just best to start eating healthier, reduce the calorie intake, go on an alcohol holiday, less sugar, fat, and salt. This begins to sound like Lent, right? And then just try to, in general, over the year, avoid the big weight gains. And sometimes seek a little bit of weight loss. Here are some other things. Artichokes.
Yes.
It was interesting. The ingredients in it, the silymarin and canaria. I was looking up these things. Please don't ask me about these. But it seemed to be even the leaves of the artichoke had these flavonoids within it, much like what we always talk about, flavonoids in grapes and the skins of grapes and wine, while red wine may have some type of antioxidant process. And dandelions, that was interesting. So it's in the roots, the dandelion root. Almost can start mixing all this stuff together. But who knows what, it's what's been used over the years. Choline is interesting. It is a amino acid, and it's essential to help the liver transport the fats out of the liver. And fascinating thing is if someone's just vegetarian alone, they may need a little supplement of choline because they're not getting it in their diet. And it comes in fish, in eggs, in poultry, in dairy. So there is a little bit of this. So you start seeing to actually transform out the fat that you've stored within the liver. You do need a little bit of this choline. So there is a supplement of choline that vegetarians can take, as well as we've talked, the vegetarians need to supplement B12. N-acetylcysteine was interesting. It's a precursor to glutathione. Once again, it also is available in a supplement. But once again, no studies. It's just people out there just doing it. And here are the foods that may be very helpful. Garlic, green leafy vegetables, cruciferous vegetables, the broccoli, the crunchy stuff, the citrus fruits, olive oil, walnuts, blueberries. That was the one of the lists that seemed to be a natural way. Take a break from alcohol. I mean, it just, it's recommended that women 1 drink, men no more than 2. But even then, as I was saying, after multiple days of it, there is minor damage every single day that may be going on, even of the esophagus and everything. So giving a break from alcohol, there even at any degree of alcohol is associated with a slightly higher risk of cancer. So, and I can't say I'm a teetotaler, so I do have my beer and occasional wine, but even with that there is not a no risk, in any kind of alcohol consumption. Harmful, helpful. It's interesting. Detoxes. This green tea extract. That was one that I just wanted to. Green tea was not a problem, but this pill form of green tea, people were taking too much of it, and actually there may be a genetic tendency not to be able to process it quick enough, and they were developing hepatitis and even liver failure from green tea extract. It's something. So I guess you'd have to check your genetics, but it's not something. But green tea is not the issue. Over the counter, there's just so many herbal supplements, things out there. And actually, there is a condition called drug-induced liver injury, and it is from all of these supplements that are just out there that are just being unregulated. So 20% of liver injury is from inappropriate use of supplements. It's just people think they're taking it because it's supposed to be good for you, and they find out later they've injured their liver. So we talk about medicines. This comes up all the time with everybody. What about statins? This works in the liver. The cholesterol production, lipid clearance is all in and around the liver. The bile is part LDL cholesterol. It's needed to some degree. So the liver is making this all the time. And what we do what happens with the statins is they block a process of that cholesterol synthesis, and it's at what's called HMG-CoA reductase inhibitor. A big long name, but you have to practice that many times. But it's at that level, and the problem that actually happens is not as much liver problems. Rarely do some people may develop a little elevation of liver enzymes, especially if they have fatty liver. Go figure that. And so it can be a little bit more inflammation, but not so bad. But true liver injury and failure from statins is extremely rare. And so the liver is less of the problem. More people talk about muscle and the muscle aching and the muscle, and that may be the coenzyme Q10, the lack of the body's production of CoQ10, and it's if you look at that process, and that's why actually instead of statins, there a new medicine called bempedoic acid is coming out that's a little higher up and does not lead to a drop in the CoQ10. And guess what? It doesn't have the muscle aching with it. But liver failure and liver injury is extremely rare with statins. In fact, statins have been used with patients with hepatitis Go figure that. And there's actually a study. I have not started someone on statins who has active hepatitis, but it actually, there is data out there. Someone did a study and did not lead to, I would not have wanted to run that study. Non-alcoholic fatty liver disease, you're at risk of this, or this is the MASH, if you have a family history of it, if you are overweight or obese, if you have high cholesterol, high triglyceride levels, this problems with type 2 diabetes, insulin resistance, polycystic ovary syndrome, more at risk for it. And basically the metabolic syndrome, as we've talked about. Tests, essentially, you can ultrasound the liver and see fat in it. You can do liver tests, but they don't always get if you're having insulin resistance and triglycerides are up, you may be more at risk that you've got the fatty liver. There are these specialized tests for looking not only how much fibrosis, so the gastroenterologist can use these tests, the FIB4, the ELF, the enhanced liver fibrosis tests. There are measurable things. There's all these hyaluronic acid, collagen 111 amino terminal peptide. Boy, I mean, so, or tissue inhibitor of metaproteinases. And so, oh my gosh, so, or you can biopsy the liver, you know, if needed. So, I mean, but liver, yeah, that was my least fun, liver biopsies and bone marrow biopsies were my least favorite thing in internal medicine when going through the training of it. I think I was very happy to go into cardiology and not have to do those again. But yeah, to stick something in the liver, pull out a section of the liver. You know, yes.
Are those tests for cirrhosis or fatty liver or any liver disease?
Most of those were that I was mentioning there was as it was heading down more the cirrhosis levels. I think if a person has a good bit of insulin resistance, the metabolic syndrome, ultrasounding the liver is probably very reasonable test to do, and then they can actually even give a quantitation of how much liver is involved with fat. So to get a friend of mine came home and said he had 50% of his liver was fat. And of course he was ordering a hamburger and fries and everything else. And I mean, he's a physician. And I'm like, and when are you going to start trying to make some changes? And it's just like, he's just a beef eater. And you wonder why. It's just very, very, it just shake my head, that it's that you know what to do, but you don't do it. And that's human nature in many ways, even of physicians. Actose was a type 2 diabetes medicine that we don't use a lot or don't see a lot. Actually, it leads to a bit of heart failure in some people. So, but it was fascinating that it could remove some of the fatty liver and inflammation. There's this new medicine that is, I'm sure, very well designed and very expensive that has been shown and used to sort of people further along, and the Resdifra. But it is those people with fatty liver, with some degree of liver scarring, cirrhosis, and this moderate to advanced liver cirrhosis, and it's helping to release some of this liver fat.
Along with exercise and diet.
Well, that's right, combination, yeah. You can't just rely on medicines alone to get you there, or, did I mention it here? The GLP-1 agents also have been used. hope I somehow that slide may have disappeared on me, but those Ozempics, anything leading to weight loss has also been showing, the reduction of fatty liver and actually being followed with it. We mentioned warfarin, just that it is, factors are in the liver, your vitamin K factors for clotting, and only warfarin should be used for heart mechanical valves, not
I want to ask
the.
a question about that.
Yes,
I'm on Eliquis and I had an aortic valve replacement.
yeah.
Is that saying it doesn't work?
No. This is a mechanical one.
Oh,
So
okay.
you could have a bioprosthetic, valve and be fine.
Okay.
Yeah. That's if it's back to a tissue valve, but it's just they did a trial with mechanical valves and Eliquis, and I was hoping it would show positive results, but they ended up stopping the trial.
Okay.
Must have run into issues. They just stopped the trial. So it got going, and then next thing you know, the trial was done and people were back on warfarin. Anytime there's inflammation of the liver, for whatever reasons, hepatitis, whatever the hepatocellular cancer issues, so patients with hepatitis B have higher rates of liver cancer. Heart and liver transplantations have been done simultaneously, obviously very complex, and thankfully I don't have to manage that, with here. I mean, they are done at Shands, they're done over at Mayo Clinic. It is, what a huge process that would be. In summary, I pointed out that the liver is a vital organ and we can't live without it. Too much fatty liver creates multiple problems. The metabolic conditions that we've gone over, they can lead to cirrhosis and liver failure, and we've gone over that. Statins work in the liver to lower cholesterol, but it is rare that statins are going to create a liver issue. And then back to lifestyle. Nutrition changes, calorie reduction, weight loss, these are the initial treatments. And just we're going over the healthy foods, and of course that alcohol reduction, increased physical activity, better sleep, on and on and on. But that's just, I know you'll hear me say it too. Probably go, there he goes again. But that's the liver. All right. Questions about liver or heart?
Metabolic syndrome?
Metabolic syndrome.
You never hear anybody say anything about that any longer. Why is that? And as a patient, how can I approach my primary care and say, I want an evaluation for my estrogen, progesterone, cortisols? How do I do that?
Yeah, it is, just basically asking the direct thing back. If I have this, I want to know more, and I want to know more about how to get it better. I think, I've felt this urge and push to actually, for cardiology, and even with our own group, we're recruiting a cardiologist. I hope she joins us from Minnesota, but creating what's called a cardiometabolic center of excellence. So basically a center that will address all of those things. I'm sure if you've got diabetes, to get an endocrinologist, you have to have a hemoglobin A1C of 9.
Oh, wow.
That's almost, your pancreas is beginning to fail. And so there's all this in between, that we've got patients with lipid disorders, with hypertension, hyperlipidemia, and they're just not being adequately addressed by the primary care.
Well, thank you for saying that, because I know that there are probably people in the room that feel that way.
And it's just not being done. It's in fact, I get people daily with lipids just through the roof, and they've been checking them for years, and it's all so well documented, what the numbers were, and just when was the discussion, and when was the, and yet, you can't wait you can't refer it to the endocrinologist because they, and even the lipid center is not, you know, so we may have to create, that in between, where a place like cardiac rehab is actually that auxiliary part of it that helps people get used to behavioral changes, you know, along the way. You know, Nancy knows if I had my dream, it would be to even have a teaching kitchen and have dietitians involved with it, because we all need to learn more about food and preparing and storing and just going to healthy food. And yet we shortcutted that for so long, you know, and you know, that we lost our skills a bit. And you know, my wife keeps drawing me into the kitchen to teach me skills just in case. So I'm getting better. And in fact, I got a book yesterday. It's written by 2 members of the American College of Lifestyle Medicine, and I wish I'd taken a picture of it, because it is about for the treatment and reversal of coronary disease. And it's really this, Dr. David Katz does the forward, it's
He's
really
good.
well done, yeah,
He's
and it's, then it's just lots of chapters and menus and things. I'll take a photo of it and bring it in here next time. But I don't have the whole name, I know, and the 2.
I'll get it to
it's-
everybody when he gives it to me.
It's more of a, it's fascinating, because a lot of it will lean a little bit more toward, you know, Indian type cooking. And some of the ingredients are things I've never seen in the South. So I'm gonna have to learn, you know, but that's, I think that's part of this whole process, is, you know, that healthier food is out there in the world, and it's not really in the United States.
Well, and our diets are pro-inflammatory. They encourage inflammation, whereas we need an anti-inflammatory diet, which is a lot of those healthier foods.
Yeah, I mean, I think it's fascinating what's, you know, way people elsewhere do eat. It's clearly the amounts are not as much. The amount of cheese is not as much.
Oh, yeah.
I mean, the overall fast foods, processed foods, you know, restaurant foods, it's just not as much.
The restaurant should provide, if you go there, and what it is in that soup, in that whatever
The
it is.
amount-
So
It's
you
salt.
have to
I got right. Salt will be one of the
It's so
ingredients.
good, it's so
Yeah,
good,
yeah.
yeah, but when you know what is there, you don't want to eat it.
Yeah, I will give my salt. I haven't given a salt lecture here.
That would
be
That would be
next
fun.
week. Yeah.
Because I went through a day. You know, Nancy's given me some good thoughts. Actually, I'm working on the back and neck issues. I can't wait to come in here with all my show and tell of all the things that I've used for myself to rehab from injuries. And when you see it, you're going to be, gosh, that Dr. Smith's probably. But I was laughing the other day when I was just bringing them all out. Y'all going to laugh at all the different things that I was doing, especially when I had my hip injury and trying to rehab it, which got finally rehabbed by surgery, but it was not. But now I have no hip problem. And I have all this stuff that you'll see that you can use for muscles and back and myofascial. I mean, I became an expert on a lot of
Alternative.
things. Yeah, but we will that you're going to really enjoy, because I'm going to talk about sitting disease a lot in that, and all the things that happen from sitting that are not good for it. We have to counteract that every day. Yeah. All right. Yeah, that's great.
Thank you, Dr. Smith, and all.
Yeah, thank you.